name is Philippe Legenne, and I am the medical head for hemato-oncology for AMGEN in Europe. As such, I oversee the medical programs, the clinical development and medical affairs programs that we put in place to support our portfolio in Europe across products. The field of patient engagement in cancer has evolved a lot in those past years. Very much because cancer care is improving and patients are living longer. Many more patients are living longer. You know, we are really moving this needle. Everyone involved in caring about cancer is really moving that needle. And so, and little by little, we are transforming the cancer care into a chronic care. So, it's very good on one hand, but it has created the need for different approaches. And for example, you know, some symptoms like fatigue, or which were very hard in the era of chemotherapy, in the era of immunotherapy or targeted therapies, it's less, but it still is there. So when you suffer from mild fatigue or mild pain for a long time, it's a different need than when we suffer for a lot of fatigue for short term. So patient organizations can help the patient understand what to expect and help them and help support them throughout the treatments. So cancer care has evolved a lot, which has uncovered opportunities, but also a need for the patient organization to support their peers slightly differently than they used to do in the past. In pharma, we are technicians, and so we think of what's the best for the clinical trial, but sometimes there's a risk that this clinical trial loses its appeal to the patient community because it becomes too technical. So it's very important that patients bring us back into reality. Patient organizations, they play a critical role into let's say, communicating to the patient community which clinical trials the patient could embark upon. They are the best advocates for that. And what we need to do in pharma, and it's fairly easy to do if we work well together, is to explain to the patient organizations what trials are coming up, what trials are currently open, and how the patient advocacy groups can help communicate this to their peers. Last, perhaps, is how those complicated results, very technical results of clinical trials, what do they mean in layman's or in patient language? And this is where patient advocacy and patient advocacy experts can make this translation into something which is meaningful for the patients. It's important that patient organizations become savvy and experts at fostering this discussion and this dialogue between the different healthcare partners, regulators, payers, pharma, doctors. And in order to integrate all those contributors to care and to access to care. And it's very important that patient organizations become expert at that. And it's complex. Because it borrows from economics, it borrows from clinical endpoints, from patient-reported outcomes, and it also needs to be a bit practical. So it varies by country, by region, by payers sometimes, because all of those very much shape the patient access to the best care. I guess my personal pledge to patient is that we have all to understand that we either have been patients or will be patients or know patients. So it's all very focused. It's for everyone which we are doing that. So what we need to very much do is integrate early on, embed into the way we develop our product from early on to very late. Patient engagement, patient stimulus, and patient perspective. And so we need to have patient representatives sit with us early on when we develop our protocols, when we execute them, when we articulate the results, and also when we think of how new products should be accessible and embedded into future care. In order to do that, we need to help patient organizations grow, become very mature, to the point that sometimes we are not going to be very happy about what they tell us, but this will be a sign of maturity and true partnership. So I really hope that we can help accelerate this maturation of patient organizations so they can play their role at best, advising the different players in the healthcare system, pharma, regulators, payers, and doctors.